Okay, I want to welcome to the show Dr. Celestine, a board certified OBGYN and host of the Vaginas Only Podcast. Dr. Celestine, welcome to the show.
Thank you. Thanks for having me. I'm glad to be a part of it. It's an interesting topic, one that I like to talk about. I used to be like a runner back in the day, so I'm
Okay.
glad to talk to you about that. Yeah.
Okay, we always can recruit you back to the confines of the running community. We're taking open applications. You're always
Oh
welcome.
gosh. Thank you. Thank you.
Yeah. And I know a lot of my listeners are probably wondering why am I having this conversation with an OBGYN. I'm probably not the most qualified person to go over the topic that we're going to be talking about today. And I will tell you where a lot of this came from. A few years ago, I ran a marathon, and around mile 10, I believe, a pregnant woman passed by me. She had to be about 6 months pregnant, and she was flying, put me to shame, and she was really getting up. So
Mhm.
and since then, I've on and off, I've kind of browsed the topic of running while pregnant, seeing
Mhm.
different sides of the offense of how some people think that there's an issue, other people think there are not. I always
Mhm.
feel like it's best to get a expert opinion before coming to a conclusion myself. So my first question for you, for pregnant women, are there health considerations that they need to take into account before doing a long run, like maybe a 10K or a marathon?
Yeah, I mean, it's similar to almost like when you're not pregnant. You have to make sure that you warm up just
Hmm.
beforehand. You have to make sure that you kind of have enough calories to sustain the run. When you're pregnant, you have to think about having a little bit more calorie intake than when
Hmm.
you're not pregnant. You also have to make sure you hydrate, have some way to have water on you. Because when you're pregnant, you have to increase your water intake at baseline, even when you're not running. So when
Wow.
you're running, you have to make sure you're staying even more hydrated than you normally would. So I always tell pregnant women, even without running, it's about 80 ounces of water a day, maybe like 8 of those water bottles, like the regular size
Wow.
ones. If you're running, it's even more so that you have to
Okay.
stay hydrated. It also depends, there's, some health risks. So just make sure you always talk to your doctor. If you have a uncomplicated single gestation, not twin pregnancy with no
Mhm.
issues. Usually there's no additional health considerations that you kind of have to consider off the bat. It's also great if you've already been a runner. It's if you've already been running marathons, already been running long distance and conditioned to do that, then keep doing it.
Okay.
So even if you haven't, you can still start, but you have to start gradually.
Okay. Now, what would you suggest as like a gradual start for a person that's just cold turkey that hasn't run before, but they found out that they're pregnant. They want to keep their health intact for the newborn that's coming.
Yeah, I mean, start kind of fast-paced walking every day. Like, let's say you really haven't done anything. So
Hmm.
start fast-paced walking every day, building that up to jogging, making
Hmm.
sure that while you're doing it, you're not like go push to a point where you're not too much out of breath. You have to always kind of be able to breathe and maybe even talk a little bit while you're running. That makes us know that you're at least able to take in enough oxygen.
Hmm.
So kind of push yourself to that point and then, a little bit further each time until you get to where you want to be.
And backing
Hmm.
up to what you said about staying hydrated, I know one of the
Hmm.
ways that typical runners find out what their sweat rate is to find out what they need to drink is by kind of doing a weight test where they may go for a
Mm.
run and then afterwards, after the run, they weigh themselves post and pre-run. Is that something similar a person that's pregnant can do to make sure they're getting the right hydration while they're running?
I don't see why not. To be honest, I didn't know that people did that frequently.
Yeah.
When they're like real avid runners.
Mhm.
But I don't see why not. I think that could be really similar. Hmm.
Is there any type of particular foods? I guess again, it depends on the person. Particular foods a woman should
Right.
be eating when doing any type of long distance runs, or anything they need to take into consideration when they're planning a meal before doing high intensity exercises.
Yes and no. I mean, I'm sure there's lots of like marathon and high intensity diets out there for just like avid runners, whether you're male, female, even when you're not pregnant.
Mm-hmm.
It's more about the amount of calories that you're intaking. So you just need to make sure maybe about like 300 more calories during the day, 3 to 500 more
Wow.
calories during the day, than you would normally at baseline if you're not running like that day, just to sustain the run.
Wow, I would love to
Mhm.
take on 300 more calories during the day. That'd be a plus. Um, so in referencing the pre and post benefits of
Mhm.
exercise in general, not necessarily running, but exercise, what are the benefits that for both mom and baby that they stand to gain to staying active while pregnant?
Yeah, there is so many benefits. So as long as it's safe for you to be active and to be not just running, but all types of exercise, it increases your energy. So in pregnancy, you're often just more tired, and it
Hmm.
helps to increase that energy. It also helps to decrease pain. So sometimes people with lower back pain or some like pelvic pressure here and there, it helps to decrease that sensation, in a lot of pregnant women that are still active. It also is a stress reliever, just like it is when you're not pregnant. And as you mentioned, you were saying you don't know what your partner went through. It's
Hmm.
pregnancy can be stressful. So having that
Right.
time by yourself, even running headphones on, like it helps to relieve some stress as well. So that's a great aspect. But in terms of pregnancy too, you recover faster.
Hmm.
Um, so somebody that's really active will recover a little bit faster after a delivery, which is always great. And it makes labor sometimes a little bit easier, especially if you're somebody that's like stretching a lot, like doing the like hip workouts, opening up your hips, things like that. Plus the running, keeping active in general can make labor easier for a lot of people. Some other ways it kind of affects the baby too is helps to maintain your weight. So
Okay.
if you're maintaining your weight, you have a slightly decreased risk of having things like diabetes in the pregnancy.
Hmm.
Um, you also, it's been shown to decrease risk of hypertension disorders in the pregnancy, like preeclampsia, gestational hypertension, and decreasing, risk of C-section and things like that also. So that is a way it kind of helps mom and baby. And I've seen some studies, like I'm not a pediatrician, but I've
Yeah.
seen some studies that say that long term for the baby, being active in pregnancy can decrease some long term obesity risks and cardiac and like heart disease risks. So,
Wow.
um, in general, as long as exercising in pregnancy is safe for you, then there's a host of benefits.
So I'm hearing you say, and correct me if I'm wrong,
Mhm.
for women that are more active, is it more likely for them to have a natural birth versus cesarean type of birth?
It is. It is. That's what the studies show. Yeah.
Okay.
Mhm.
Okay.
It's not a guarantee, right? Nothing in life is a guarantee, but
Right.
yeah, more
Okay.
likely, yeah, for sure.
Okay. Um,
Mhm.
and talking about the trimesters of
Mm,
pregnancy, are there
mhm.
certain phases within the trimester that you wouldn't suggest or would suggest for a person to start or stop doing any type of extreme exercises or doing something like a marathon?
It depends on what your pre-pregnancy exercise was like.
Mm,
So I wouldn't just start doing a marathon in your third trimester if you never ran before that. I would
mm,
say to clarify too, no, the answer overall is no. It's not like by trimester you do X, Y, Z. It's really
okay.
on your pre-pregnancy condition and how you've built up your conditioning during the pregnancy and what level you're at. So it's not really based off trimester. It's just based off your pre-pregnancy condition and current pregnancy condition,
Right.
when you start exercising. So like I mentioned, starting gradually if you're brand new. If you've always been running marathons, keep running the marathons. It doesn't matter what trimester, as long as there's no medical issues going on in your pregnancy.
Okay.
Mhm,
And how does classes, I know when I was going through the my three pregnancies with my wife, they had
mhm,
classes like Lamaze classes and breathing
mhm,
classes. Is something
mhm.
like that still recommended as part of the preparation for giving birth to the baby?
Yeah, I think, there used to be a time where even especially on television too, it was almost like
Mhm.
standard that that's what you have to do, right?
Yeah. Yeah.
The he-who's and going to the classes.
Yeah.
But really I find with the women these days that come to my office, it's based off what makes you comfortable. Some people actually find those classes to be stressful for them,
Wow.
because they're explaining things that they don't really want to do, or that's not how they wanted to experience a birth. And some people find it anxiety relieving. And, especially if they happen in the hospital where they're delivering at, they can see the hospital before they get there, things like that. Hospital tours too, that kind of stuff. So it really depends. It's based on the person. I will say when you come to labor and delivery, as long as I always tell people, make sure the doctor that you're going to go through your pregnancy with, or the group of doctors, you're comfortable with them. Once you get to the hospital, the doctors and nurses, everybody will guide you. You don't need like extra preparation if it's not something that you want. And if it is, then great, go for it. It depends on what makes you comfortable.
Right. And I think it's something to be said about, and I know in your profession, you probably see all different flavors of the situation where you may have the person that's pregnant for the first time and they want to make sure they're doing everything right versus a person
Mhm.
that's been through the process of a few different times. I guess does doing things like that far as meeting the staff that may be helping out with the pregnancy, does things like that help the process?
Yeah, I think so. Especially well, for every mom, but I really feel like it's great for first time moms too. Going to see the hospital if you've never been there. Before it's like, I don't want pregnancy and labor can be really overwhelming. You're in a lot of pain, it's hard
Yeah.
to breathe, you have to push for however many hours. So it's nice to be there and meet the people and view the facility when it's not in this like hectic environment. So to do
Yeah.
it ahead of time, I think it can be beneficial. Yeah.
Are there certain things that a woman needs to look out for, in particular to their weight?
Yeah, I mean, first of all, if you are exercising a lot, you need to make sure that you are not losing too much weight. In pregnancy specifically, you just don't want to be losing massive amounts of weight in your pregnancy that can potentially impact the growth of your baby.
Mm,
But I will say most of the time that's not a concern. I mean, every OB visit, we're checking that. We're also sending you to get ultrasounds, checking on the growth of the baby. So, and a lot of pregnant women come to me and they think that they're losing weight, and then that's concerning. But it's not just
mm,
losing a little bit of weight. It's like if you're drastically losing a lot of weight, that's more concerning. And there's some people that actually start out in pregnancy at a really high weight that we
mhm.
recommend that you don't really gain any extra weight during the pregnancy or maintain that weight. And even if you lose a little bit in the beginning, that's okay too. It doesn't affect the baby's weight. So it's more like the drastic amounts of weight loss during pregnancy that's more concerning. In terms of weight gain, I mean, when you're exercising, you do gain a little bit of weight. Sometimes it's
Right.
more like muscle weight than, fat weight. But if you really are somebody that's actively and avidly working out, I don't really see it so much that you're gaining too much weight at all. But normally, with like a normal healthy pregnancy, starting with a normal BMI range, we recommend that, you only gain about like 25, 30 pounds during the
Oh.
pregnancy. So that's what's been recommended. Of course, some people gain more, some people gain less, and the babies are still okay. But I'm just quoting the actual recommendation.
I think the thing that I can remember back to my wife's stressors was the whole percentile scale, where you
Mm.
may be quoted, you're in the such and such percentile, you're in the 65th percentile. Um, Is there a different method of measurement just to make sure that the lady is staying on track or staying in a comfort zone to make sure that the pregnancy is still going through a healthy pregnancy?
When you say percentile, do you mean the baby's weight in the
The baby,
percentile?
yeah, the baby's weight percentile. I'm
Okay,
sorry.
it's okay.
Yeah, yeah. See,
um, I just wanted to clarify. You never
yeah,
know.
yes, yes.
But yeah, and a lot of times also, I mean, yeah, you 50th percentile is average, right?
Hmm.
You just ideally we don't love if you are above the 95th percentile in the baby's weight or below the 10th percentile, because
Okay,
that's large for gestational age baby, or small for gestational age baby, or IUGR, we call it, intrauterine growth restriction. So
okay.
somewhere in the middle, you don't have to be exactly at 50, but somewhere, above 10, below 95 is technically ideal. And that's just for many different reasons. Usually the smaller side, if there's a restriction to the baby's weight, we worry about adequate perfusion to the baby, which becomes a problem where we might have to deliver early, or if a baby's too big,
Right.
increases risk of things like C-section or NICU stays sometimes because larger babies find it harder to control their blood sugars and things like that. So, um, for those reasons, those, greater than 95 or less than 10th is the more risky ones, but everybody else that's in between, don't stress too much about it.
Again, I'm thinking back to
Mhm.
my last my last child. I think one of the things that was measured was like the amount of fluid that was there
Mhm.
for the child. Is that kind of the method that's used to measurement method to see whether they're still in the healthy zone?
No, it's totally separate.
Okay. Okay. Okay.
Fluid around the baby is a totally separate entity. To get the baby's weight, we measure different parts of the actual child. So head circumference, abdominal circumference, femur length, things like that. The
Wow.
fluid is totally separate. Yeah.
Okay. Okay. Is that something that's impacted that fluid? Exercising, does that impacts that fluid? Is that taken or siphoned as a person
No.
exercise?
To be honest, I really think truly that exercise is like really safe in pregnancy. If
Okay.
something does happen in terms of low fluid or a baby that's out of the percentile range that we want, it's usually not directly related to your exercise. It's something else that's going on.
Okay.
So I don't want pregnant women to stress about exercise. Most of the time, exercise is a positive thing. And
Good.
if something, like I said, goes on in the pregnancy, it's not usually related to you exercising.
Relates to the actual child in the woman's belly. I
Mhm.
could think back to that marathon and how fast the runner was moving. And in the back of
Uh-huh.
my head, I can just imagine the child just jiggling
No.
around. Is that something that's harmful in any way to the child while they're in their mom's stomach?
No, the child is really well cushioned in there. That fluid that you mentioned
Hmm.
supports the cushioning around the baby. The uterus is a big muscle that's around the baby, plus the mom's, abdomen and the fat tissue and everything really um cushions the baby really well. So what
Okay.
we say is when you're exercising, you don't want to do anything so one of the things is you can lose your balance a lot when you're
Okay.
pregnant because your center of gravity is different. So you want to not do something where you can potentially fall. So directly falling on your abdomen or falling on the ground, those kind of
Mhm.
like bigger jolts are more concerning than just like a rhythmic run. And also because for the mom, actually, the jostling around can be a little bit more risky because your ligaments are a little bit more loose. So you have a higher chance of injury,
Okay.
knee injuries, things like that, just from movements that you did before that wouldn't have caused those injuries, could cause them in pregnancy because your progesterone hormone is so high that it makes all of your ligaments loose. So the stability of your joints are not the same.
Wow.
So I worry more about the jiggling of the mom in that sense,
Okay.
more than the jiggling of the child. The child would be fine. But really overall, most pregnant women, especially if you're conditioning yourself, doing the exercise gradually, warming up and cooling down, those risks of injuries are really low.
Okay. So don't be a clumsy pregnant runner is what you're telling me. Is that what it is? Okay.
Just don't do
Okay.
anything. So I find people too, they'll start doing, yoga for the first time and start doing all these advanced positions and then they'll fall. So you have to
All
be
right.
just mindful of what you're capable of doing and don't put yourself at risk for falling.
Okay. And that's something that I feel, um, again, going back to my wife, she's gonna be like, you talked about me a lot in this episode. That it took her a while to regain her sense of balance after the
Mhm,
child was born because they were so
mhm,
used to having that weight.
mhm.
Typically, how long does that take before a woman regains that equilibrium of walking without that added weight in front of them?
I mean, everybody's a little bit different in terms of not just the weight aspect, but it's really the hormone shifts.
Right.
And especially if you're breastfeeding, those hormone shifts continue for as long as you're breastfeeding as well. So it depends on each individual woman in terms of that aspect.
Okay.
So
And
there's no exact timing.
that brings up another thing. So Does that impact the breast milk production running? Does that pull away from that?
Not if you're eating enough calories.
Okay.
So breast milk production is all based on eating extra calories, the 3 to 500 extra calories per day, and lots of hydration. That's how breast milk, becomes produced. So you have to make sure that if you are running, doing extra exercising. So normally we say just for breastfeeding, 3 to 500 extra calories, just for breastfeeding alone. So if
Okay.
you're running, you have to probably double that.
Wow.
Especially if you're running like avidly and you're a very big runner, every single day and things like that. So it's great to talk to your doctor about that too, because you can kind of track your weight, track how much you're running, talk about what's going on with your breast milk and help adjust things if need be. But yeah.
I'm not sure, and this is another question, not sure whether you know the answer to, whether things like sweating will clog the glands to prevent feeding a child. 'Cause I know that can happen sometimes where the glands can get clogged. Is that something that will be impacted or could possibly impact depending on if a person sweats too much or a woman sweats too much?
No, the clogged milk duct is a totally different part of the breast than the sweat glands.
Okay.
So no, not really affected by that.
Okay. Okay. Keep me straight.
Yeah.
Keep me straight.
Yeah. That's what I'm here for.
Yeah, yeah. So, we have an open and honest conversation here. Um,
Yeah.
so now talking post pregnancy, how
Okay.
long does it take for before a person that runs or exercise can get back to doing any type of active exercise activities?
I would say so almost right away. I mean, your pregnant body, we say, is not really back to baseline, which I almost hate that term because everybody's baseline is different. But
Hmm.
usually about 6 weeks after pregnancy, you have a visit with your doctor, like a pregnancy specific visit where we check a lot of different things and we clear you back for your normal activity. But especially if you've had a vaginal delivery, sometimes you can go back to activity even faster. It might not be running in high intensity every single day, but it might be stuff like light weights or doing exercises for a diastasis recti for your abdominal muscles and things like that, which is a condition where the muscles separate just from the pregnant belly, pushing it out. And there's
Right.
different exercises that come back together, simple things that aren't really like overexerting. But if you've had a C-section, for example, now you've had a major surgery, you have a scar on your abdomen, so probably a little less likely to be going back to exercising 2 weeks out, probably more towards the 6 weeks after.
Right. Now, what kind of things can a woman do if they have that longer end to make sure they're keeping active as they safely can? What are there any specific exercises you would suggest just to keep them to keep the blood flowing to keep them active?
Well, we always recommend walking.
Okay.
Okay. Never underestimate the power of walking, especially
Hmm.
if you're walking like 30 minutes or so a day, get some fresh air, be outside. Even if you bring your baby, put them in the stroller, walking is definitely a great exercise, definitely better than doing nothing. Also, some light weights. I mostly would talk about doing like arm light weights, like 5 pounds, 10 pounds, depending on what you were doing prior to pregnancy, bicep curls, things like that. I don't really recommend doing things like squats or anything that puts a lot of pressure in the vaginal area.
Hmm.
Because let's say you had stitches there from a vaginal delivery, or if you've had a C-section, you don't want to put too much pressure on the pelvis and perineum that can disrupt that healing. So more like upper body workouts, and walking.
Okay. And what is the name of that term again when you said the muscles spread
Oh,
apart?
diastasis recti.
Diastasis. Okay.
Mhm. You could say
Di.
recta diastasis of the rectus muscles. You could say it that way too. Or
Okay.
just separation of the rectus muscles.
Okay, so separation of the rectus muscles, that's when the your abs are basically split, right?
Mhm.
Is that correct? And is that part of um and I want to make sure I'm quoting you right. That's part of C-section. Is that correct? Am I saying that
It's
correct?
any delivery.
Any
So it's
delivery.
just the fact that the uterus is pushing out on those muscles that causes them to separate. Just
Okay.
the fact that you have a pregnant belly. Some people have a little bit more separation than others, especially once the child's delivered. But usually everybody has some degree of muscle separation after having a child.
But how long does something like that take to your body to kind of recover from and get back to some semblance of the way that it was before?
I always say after you have a baby, you're never the same, whether
Right, right,
that's body
right.
or mentality, it changes every woman in a different way. But um technically, like, if let's say you do absolutely nothing in terms of exercises, for example, to help those muscles come closer together,
Hmm.
it might never go back together 100%, even if you are doing the exercises.
Wow.
And if you are doing the exercises, it can even take up to a year, or a little bit more for you to get a similar core strength to what you had before and a similar closeness of the muscles. So you might always still have like maybe one finger separation or two finger separation, but there are exercises where you can bring it, from four finger separation down to two and things like that. So it might never be perfect, and it does take a long time. So I always tell
Okay.
pregnant women in the postpartum period, especially those that have been really active. Like, I was very active before my pregnancy,
Mhm.
but you really can't do like direct sit-ups and things like that. That puts more strain on the muscles. You have to do more side planks and kind of the in and outs, they call them. I tell people this is the one thing I tell people that they can YouTube is exercises for diastasis recti.
Okay.
Because there's lots of, and it's not even overexerting. It's things you could do while laying on the floor or, watching a TV show just to help your muscles, but it can take quite some time to get that strength and that closeness back.
Okay. Okay. That's fair. Um,
Hmm.
and the last thing I want to touch on today is postpartum. I know
Hmm.
that that's something that a lot of women deal with, and it could linger on. Are
Hmm.
there does exercising help with postpartum conditions,
Like postpartum depression, for
postpartum
example.
depression
Yeah.
in particular? Yes.
Yeah, definitely. I mean, exercise is all about endorphins, all about, increasing the feel-good hormones, all about stress relief. So, definitely. But I will say, it's not the cure-all for those that like severe postpartum depression is a real thing.
Right.
Um, you can't just tell women, oh, just work out, you'll be fine, or
Right.
do this more, you'll be fine. Like, it's a real mental condition that sometimes needs medication treatment. So although, yes, like postpartum blues is a thing,
Hmm.
where it's not the full postpartum depression, exercise is great for that too. But yeah, definitely not the cure all, but it's not going to hurt.
Okay. And when should a woman seek additional help when they're dealing with something as bad as postpartum depression? What are some key signs that they need to ask for help?
I mean, I and hopefully other OBGYNs are doing this. I see most of my pregnant or postpartum women shortly after they deliver, so about two visits. So shortly after, and then like a couple months after. Um, and then you have those check-ins with your doctor first and
Hmm.
foremost. But if you're really somebody that's crying every single day, you're not even finding the joy at all in having a new child or bringing this child into your home, pure depression signs, like you're not just unable to sleep because of a baby crying or feeding, but like you're not able to sleep. You don't find joy in everyday activities anymore. And you're crying or really even anxious or agitated over small things. I
Hmm.
think that's the time to look into getting some help and getting some assistance, which is not always medication. Sometimes it's a therapist. I advise a lot of my pregnant postpartum women to see therapists, talk about their problems. Sometimes talking to a stranger is easier than
Yeah.
talking to the people around you that are in your life. Yeah, even like the tiniest thing where you are starting to feel like, my mood is a little off. I say get help and ask the specialists and see what we can help you with.
Dr. Celestine, thank you so much for joining me today. And if you want to check out Dr. Celestine's podcast, is For Vaginas Only. Please check it out. It's a really, really good listen. Dr. Celestine, thank you for joining me on the RVA Running Man podcast today.
Thank you so much for having me, and I hope all of the pregnant women out there stay active and stay safe while doing it.